Model, the TMJ joint is actually composed of mandibular joint with a bone called temporal bone. And the TMJ joint, these two bones connect together to create TMJ. The TMJ joint is what we call synoviocondylar or hinge joint, and it's composed of fibrocartilage, and in between the joint, in between right here, there's a disc called articular disc. The movement is usually opening of the mouth, so it actually creates like a hinge joint, and then it also allows kind of an anterior translation as well. Now, there are some major muscles that controls the movement of our TMJ joint. The first muscle is called temporalis muscle, and inside the attachment of the mandible in the inside. So there's a big muscle called temporalis muscle that can actually starts from this region, and then it travels into the jaw itself. Muscle mass, and this big muscle allows the jaw to move open and close as well. And the Masseter muscle actually starts from the cheekbone, and then it connects us to the ramus, the angle of the jaw. So there's a Masseter muscle that goes from here to here directly, and there's a smaller one that goes from the top portion of the cheekbone into the top portion of the jaw. So if you look, and it goes all the way to the angle of the jaw. So there's one that actually travels straight down, and the other one is actually at this angle, going at kind of at a 45 degrees angle. So there's one muscle going here, and the other one is going here. Muscle that actually control the jaw movement from the outside. There is an inside muscle inside the mouth itself. It's called pterygoid muscle, and the pterygoid muscle, actually in this the model right here, starts at the structure right in the base of the cranium, and they connect to the inside of the jaw. Okay, so there's a lateral and a medial component, and again, these inside muscle, just like the outside muscle, allows the jaw to kind of open up. It allows the jaws to come at an angle, okay? And these muscle has to work in sync. It has to move like a cooperative teamwork. You know, we also have traumas that can cause problems to our bodies as well. So some of the trauma that we may experience is, let's say if you're playing boxing, any type of combative sport, you get hit in the jaw or hit in the face. That can cause trauma to the TMJ joint, but also it can cause muscular imbalance to temporalis muscle, Masseter muscle, internal pterygoid. So there's muscular imbalances in your jaw, into your face, kept open for 2-3 hours, and all of a sudden it causes the muscles to be imbalanced. So sometimes that can also lead to some TMJ problem as well. Okay. What are signs and symptoms of TMJ problem? When people have TMJ, they may have pain locally around the jaw area. They may also have referred headaches. So headache on the temporal side, around the eyes, and on the back of the skull. When they open their mouth, it can actually create popping and clicking and grinding noise. Okay? It could also lead to the opening of the mouth, so you're unable to open your mouth nice and wide. Or there may be some deviation of your jaw. So when you're opening your mouth, instead of allowing your mouth to be opening straight proportionally, they may actually move at an angle. So his jaw actually moves in a very proportional way. So open mouth please, and down. Now let's say if his jaw actually leaned to the right. So the jaw actually tracks this way. So what's happening here is the joint on the right side has a good kind of a rotation motion, but it doesn't have a very good translation motion. And in this side there is lack of rotation, and it's fixated between rotation and the translation is good. Sometimes it's related to two problems here. So on the right side, he's able to rotate the joint, which means his joint's actually moving very well like this on the right side, but it does not allow translation, okay? But on the left side, it doesn't create rotation like this, but it actually translates. So that's why this may actually deviate to the right like this into your mouth. So that's quite normal. Now, if the person is opening your mouth and he can't fit his finger, all three fingers in there, then there's definitely some restriction to the TMJ joint itself. If you fell and you lost your front teeth and had trauma to the teeth and landed on your mouth, that can cause shifting of your jaw, your mandibular joint, which also affects the TMJ. So with a situation like that, you may have to visit a dental specialist who actually do a proper checkup of your teeth, and maybe you need to get some proper orthosis that supports your teeth as well. So typically some people may be more dominant on one side, so they maybe keep chewing on the right side, which causes the muscle on the right side to seize up. That creates uneven balance to the TMJ. Wearing a mouth guard, like during sports, if you're boxing or even playing football, so taking care of your teeth is just as important as taking care of the joint and the muscle and the neck. Upper cervical alignment issue. So what does that mean? If you look at the skeleton right here, this is the upper cervical bone. It's called C1 and C2. So typically when a person gets into some kind of a neck trauma, this bone may not be in the best possible position. This bone could actually twist to one side or tilt to one side and lose the normal cervical curve. Now when this bone actually starts to tilt, it actually changes the position of the occiput or the back of the skull. And when this skull is elevated and this is lower, and if you look at the side view of the skull, this occiput is attached to the temporal bone. So a lot of times when people say, well, I have a jaw problem, but it happened after a car accident or trauma to the neck, it could be related to the upper cervical. You have muscle that seizes up, and when you have Triggerpoint and when you touch it, you'll feel kind of a sensitivity. You'll get a refer pain on the side of the face into the jaw, around the eyes as well. So that's the Triggerpoint pattern for the temporalis muscle. Cheekbone to the jaw could cause pain in the bottom of the jaw itself, but also on the side of the TMJ as well. Okay, and Triggerpoint occipital muscle, which is the back of the skull. Okay, just because of the upper cervical trauma, you may have Triggerpoint all across the side of the head, including the TMJ. And the Triggerpoint that's just related to tightness of the shoulder because of the positioning of your neck could also have Triggerpoint all around the side of the head into the TMJ as well. So once again, what I'm actually trying to kind of explain is the TMJ pain or problem could be related to muscular tension and Triggerpoint. And later on, we're going to actually detect how to find the Triggerpoint and relieve pressure off your body as well. There's a lot of complexity regarding TMJ. So first thing we need to do is understand why the person is actually he had trauma, or he may even have arthritis, or she may have arthritis. But once again, it could be related to imbalances to the muscle on the temple and the jaw or inside of the mouth, or also imbalance to the muscle on the back of the skull. It could be related to neck trauma. It could be related to a lot of different reasons. So having a proper case history examination to determine what's going on is very important. Secondly, if it is related to the neck and the muscles, but also related to the face and your teeth, then we may have to refer the patient out to a specialist to have the orthosis done. So sometimes we can't do all the work ourselves, so we have a partnership with other doctors to actually assist in making some good orthosis to improve the TMJ. There's a lot of techniques that we can do to actually try and help. One of the things that I really like to use is a technique called Graston. So this is a tool, and I have many different shapes of tools, please. So I'm not going to do a full force on him, but I use a ointment and to help out with breaking or relieving the tension on the muscles of the temporalis, and also relieving pressure off the masseter area. So these type of technique, this soft tissue technique, could help break some of the adhesions and loosen up the muscle so his jaw starts to move better. Sometimes people have tight muscle inside the mouth, so pterygoid muscle. I can use my finger to go inside and create loosening of the pterygoid muscle from the top of the cranium into the side of the jaw. So a lot of times loosening up these tissues, the fact how his jaw is aligning, then I use this instrument to give it an adjustment. So it's a very precise and delicate treatment. We don't want to force the adjustment into the TMJ and cause more worsening the problem. Another thing that we also emphasize is the upper cervical alignment, to make sure the alignment of your upper neck along with the cranium does need work. And the upper cervical misalignment can be related to his mid-back and also lower back as well. So also if the person has inflammation to the TMJ, it's like swelling, it's hot, we use laser, class 4 laser therapy to help reduce inflammation and to speed acupuncture treatment and cupping treatment that he does to alleviate the TMJ. So now another thing that I highly recommend is maintaining proper cervical neck. Okay, sleeping on a very good pillow that has a very good shape and contour. This kind of maintaining the alignment of the neck takes the pressure off the better place, so the way the TMJ doesn't get inflamed. Now, if you can imagine, if the person is sleeping like this, okay, that's putting a lot of stress on the neck. Or if the pillow is too flat and there's no support to the neck, that can cause tension to the neck as well. So having a good mattress and proper sleep position is very important. And I know that some people like to sleep on their stomach. That's a total no-no, because sleeping on the stomach creates that rotation in the neck, which puts a lot of stress on the neck as well.
Anterior of the face, and then go the side of the masseter muscles and go up to the head. So when we have TMJ disorders, we also have the pain on the local area. You can have the pain go up to the head. Patterns about the chi and the blood stagnation, and also the internal organs disorder, or the function is insufficiency, especially the stomachal meridian function. Its deficiency is more easy to cause the TMJ disorder. Choose 3 different acupuncture points to improve the chi and the blood circulation in the whole bodies, and also we have a local point to improve the local circulation. It's called large intestine 4. So because this acupuncture point is mostly, it can improve the chi circulation and go up to your face and connect the stomachal meridian. This is the point. Again, this is very focused to improve the chi circulation. Second point is called liver B. So just in between the first toe and the second toe, just right in the depression of here. So that is the point. So that is the point. This is stomach 6 to improve the local circulation, to loosen up the muscle.
Is you can use your finger to kind of gently palpate. So as you actually feel around the side of the head, you'll feel kind of almost like a trigger. Can you feel that, Ethan? What does it feel like that to you? So when I put pressure, you feel it in your jaw a little bit? Okay, so when he actually felt the pain, different parts of his body, like if I put pressure here and you felt it here, those are actually Triggerpoint referred pain. So what I feel is I feel kind of almost like a lump. Now once I find it, what I want to first do is I want to just kind of hold the pressure, take a deep breath in, hold the breath, and I apply pressure inward. Not too hard, and then just exhale out, then apply a little bit. Another thing that we can do is, if your finger is too weak, I like to use this eraser, like a nice soft eraser. Find the area that's trigger, and I use the eraser to do the same thing. Can you feel that? Is it harder? A little bit harder, right? So the eraser gives enough softness but hardness to give that nice massage. Now next thing that we want to do is, once we find that trigger, I want to actually put pressure and bring it up a little bit higher. Now what he's going to do is he's going to open his mouth, breathe in, open, and then close. Okay? Now same thing, I apply pressure, open, close. Open again, close. So what we're doing, we're applying pressure to the muscle, but we're using the movement of the jaw to help stretch the muscle. Now he can be doing this on himself. He can actually feel the tempo, and then on the left side too. Feel into the angle of the mandible. there's a muscle that goes straight down and at an angle. So once again, I want to use my finger, don't do it too hard, and find an area that may be a little bit tender. Can you feel that right here, Ethan? Yeah. Okay. Now, do you feel any referred pain in any parts of your body? Down to the jaw. Okay, again, he's getting some refer. So he's clenching his jaw. So it may be related to that tension right here. So once again, I use my finger or the eraser, apply pressure. Now you can open mouth again, close it. Open mouth again, close it. Finger, like this. Okay, put your elbows down. Apply pressure. Now open mouth, close, open mouth, and close. So these are very to the upper neck, and in the upper neck itself, there's a lot of muscular tension. So what I want to do is, using my finger, kind of feel the base of the neck. Can you feel that here, Ethan? Okay. Also, can you feel that a little bit? Which is more? Right or left side? Okay, so I do feel a little bit more trigger here. So what I can be doing is, if I want to help Ethan, I hold the pressure and Ethan's going to flex his head forward and then back up, and as I come back I relax the neck. Then I apply pressure and back up. Now Ethan could be doing it on himself. He grabs the base of his neck and then apply pressure, then he goes forward, stretching the muscle. Then as he comes up, he relaxes it. Okay, then tighten it, then flexing the muscle, then relaxing. So once again, I can put pressure here and then bend away from the pressure. Away. And relax, and bend forward, away. Now he can be doing this by using his hand here, apply pressure, and then lean away. So you can kind of rotate a little bit off to the side at an angle, and same thing to the opposite side. Hold it, and then lean away. We actually help people understand the anatomy, and also to do certain things that at home by yourself, such as Triggerpoint therapy, muscle release, and having good posture and having good habit is also to your neck, or it could be something more deeper. You need professional consult. You need help, and that's what we do. We're here to help. We're here to kind of guide you. So once again, we are offering any consultation, and you can reach us at info@centurywellness.ca, or centurywellness.ca is our website.